Instead, the parasite we are going to see more commonly is going to be our small strongyles, also known as cyathostomins. And so I want to be clear that while the name is kind of confusing because small strongyles and large strongyles seem like they could be very related, they are not. And so the cyathostomins is going to be that family of parasites that small strongyles belong to. So don't confuse the two. Don't mistake the two. They're not even related, but their names are deceiving in that way. So small strongyles in our horse populations today, for our mature horses, this is going to be the #1 parasite problem. These will be the most prevalent, potentially the most damaging. And so this is normally what we are working to treat or to manage in our horse herds. These parasites have a life cycle of about 6 to 12 weeks. Once again, larva is consumed as the horses graze. So our horses who are on pasture are going to be more susceptible or more exposed to different parasites. So they consume this parasite, the larva, as they're grazing. It migrates to the GI tract, the intestinal tract, for early development. And then as they mature, they can either carry on to be reproductive or become dormant. And so, again, going down to this life cycle, when they go into this dormant phase, we call them encysted small strongyles. And they basically burrow into the intestinal lining of this hindgut. And they kind of burrow in and just go into this more or less a period of hibernation where they're just kind of sitting there, hanging out, not really doing much. And so eventually they'll reemerge and they'll become reproductive. Eggs will pass in the feces, and then that life cycle again will continue on. They pass the eggs in the feces, they develop out on pasture until they reach an infective stage and are consumed. And so what we see is horses who have this, first off, unlike our young horses who have parasites, who we might see like that round parasite wormy belly, we don't always see that in mature horses. So I'll say some things that could be caused by this parasite, but they aren't always. And honestly, most of the time, horses can have large burdens of parasites and we're not going to see anything. But when we do see it impact our horses, we might see diarrhea, weakness, colic, acute weight loss, anorexia, so they stop eating. Again, things we might see. But I've done many fecal egg counts, and many horses even have high parasite burdens, and you can't even tell. So what I want to quickly focus on is the state of dormancy is known as this hypobiosis, where basically these small strongyles encyst in the cecum or the large intestine. They can stay there for 3 months or up to 3 years. And an issue with this is oftentimes when they're in this state, when they're kind of burrowed into this intestinal lining, things aren't going to affect them, like our dewormers, right? The dewormer travels through, and the majority of dewormers aren't capable of reaching those parasites. But one issue we might see is something called cyathostominosis. And so this is ultimately this mass emergence of these arrested, so kind of these hibernation stages of the encysted larva. And so the worst part about this is we really don't know why it happens. It's not incredibly common either, so it's not something that you need to lose sleep over at night. But if a horse does experience this cyathostominosis, it is a high fatality rate. So around 50%, so 50-50 odds. As a result, prevention is ideal, but when we don't know what causes it, it's hard to prevent it. It is believed to be influenced by things like our climate, so that these small strongyles might encyst in the winter and then emerge in the spring or the summer when conditions are more suitable to them being alive. It could be associated with age, so we see it often in horses under 6 years old, but not necessarily foals. So it's kind of like this more of like a juvenile age, not fully mature, but not a baby. And then it can also be impacted by the time since the last deworming. And so when horses are on a managed anthelmintic program, that is going to be beneficial for them. Moxidectin is a class of dewormer we'll talk about, as well as a 5-day power pack, which is 5 consecutive days of fenbendazole. Those are 2 deworming protocols that are believed to reach these encysted small strongyles. They're becoming less effective, and there is a little bit of debate of whether or not we want to reach these and kind of attack or try to get rid of these encysted small strongyles. But there are dewormers that have been effective for them in the past. And so again, what we're going to see here are going to be very similar. I have symptoms. It should be clinical signs, but diarrhea, serious colic, and death. With that treatment, I mentioned we have moxidectin is a dewormer that works, or 5 days of consecutive fenbendazole, so often called the power pack. And moxidectin is going to be the preferred way to target these encysted small strongyles. But once again, we're not necessarily sure that we want to right now. So that is what we have on our small strongyles.